So you do a lot of dental implant dentistry in your practice.
Yep.
So with denture wearers, or people, the two categories, a denture wearer or people that they need a full mouth of extractions and new teeth supported by dental implants. So what are their options when they go to your practice?
Great. So of course the traditional denture that comes out is an option. Not a great option, but it is an option to give something that looks like teeth. Okay. From there, we look to go with 2 implants that the denture can snap onto. Again, a better option, gives more stability, denture's not rocking around.
And they just snap in.
They do. They snap in, they snap out. You're not going to sleep with them in your mouth at night. You're taking them out. It's an option. From there, from 2 implants, typically we'll go to 4 implants. Again, usually it will still snap in when it's in. Gives you some comfort.
They can eat like a salad or sandwiches.
You can. So you've got some limitations still, but you definitely are eating far better than when you had 2 implants. Certainly better than when you had no implants and just a denture in there. Okay.
So adhesive is gone in this case.
Adhesive is gone in this case. It is very much so. You're not living with that as part of your life anymore. From 4 implants, you're going to more implants than that. Permanent teeth on them. That right there is the option that will get you back into your life completely.
So somebody comes in with like a lower denture or needs a full mouth of extractions, you can like 4 or 5 implants and give them a brand new set of teeth that don't come out.
Permanent.
Is that
part of them, yeah.
Is
absolutely.
that common? Is that something you do a lot of in your
This
practice?
is something we do quite a lot of. This is something that, in fact, we are taking patients that have had other options, less than that, and moving them towards this because they say, you know what, it's been a process for me. Well, I've had a denture for a couple of years, then I took steps with a couple implants, maybe another implant or 2 after that. I think I'm ready to finally get to a permanent option, which has very little maintenance, gives me less to think about as a patient, and gets me really back to my life.
So no more dentures. Like
more
dentures as we know them today,
Yeah.
you think in the future, maybe 100 years from now,
Gone.
they'll be gone.
Absolutely. Yeah.
But they could do it right now.
Yeah, very much so.
And now insurance, things like that, Medicare, Medicaid doesn't cover this. But you have financing. You say people finance this.
We do. We've got a lot of patients that aren't coming in saying, I've got a suitcase of money here and let's get going. Sometimes we need to be creative, and there's a lot of great ways for us to make this doable financially.
How old can you be to get dental implants?
We don't have an age limit.
90?
We've got patients that certainly are up there in age, and we've done this with them, and they said, you know, I wish I did this sooner.
Is that right?
Yeah, very much so.
All right.
Yep.